Hello everyone. In this video we will be talking about trunk extensors and trunk flexors MMT. The trunk extensors muscles are iliocostalis thoracic, longissimus thoracic, spinalis thoracic, iliocostalis lumborum. Trunk extension for lumbar spine, patient position, prone with hand clasped behind the head, therapist position, standing position and stabilizing the lower extremities just above the ankle. Test: patient extend the lumbar spine and clear the umbilicus from the table. Instruction to the patient: raise your head, shoulder and chest off the table. Come up as high as you can. Grade 5. The patient with normal back extensor muscles can quickly come to the end position and hold position without any effort. Grade 4. Patient can come to the end position but with the signs of the effort. Now for thoracic spine, patient position, prone with head and upper trunk extending off the table from about the nipple line. Therapist position, standing position and stabilizing the lower limbs at the ankle joint. Test: patient extends thoracic spine to the horizontal. Instruction given to the patient: raise your head, shoulder and chest to the table level. Grade 5. Patient is able to raise the upper trunk quickly from its forward flexed position to the horizontal. Grade 4. Patient is able to raise the trunk to the horizontal level but with some effort. Lumbar and thoracic spine. Grade 3. Patient position is prone with arms at side. Therapist position. Standing at the side of the table, lower extremity are stabilized just above the ankle. Test: patient extends spine, rising body from the table so that umbilicus clear the table. Instruction given to the patient: raise your head, arms and chest from the table as high as you can. Grade 3. Patient completes the range of motion. Grade 2. Patient completes partial range of motion. Grade 1. Spine extensor muscle can be palpated on both the side of the spine. Grade 0. No contractile activity. Trunk flexion. Muscle responsible is rectus abdominis. Patient position, supine position with hand clasped behind the head. Therapist position, standing at the side of the table at the patient's chest level. If the patient is having weak hip flexors, the examiner should stabilize the pelvis. Test: patient flexes the trunk through the range of motion and scapula clear the table. Instruction given to the patient: tuck your chin and bring your head, shoulder and arms off the table as high as you can. Grade 5. Patient completes range of motion until inferior angle of scapula are off the table. Grade 4. Patient position, supine with arm crossed over the chest. Test: other than patient's position, all other aspects of the test are the same as for the grade 5. Grade 4. Patient completes range of motion with the inferior angle of the scapula are off the table. Resistance of arms is reduced in the cross chest position. Grade 3. Patient position, supine with arms outstretched in full extension above plane of body. Test: other than patient's position, all other aspects of the test are the same as the grade 5. Instruction given to the patient: raise your head, shoulder and arms off the table. Grade 3. Patient completes range of motion and flex trunk until the inferior angle of the scapula are off the table. Grade 2. Patient position, supine with arms at the side and knee is flexed. Ask the patient to lift head off the table. If the inferior angle of the scapula do not clear the table, it is grade 2. Grade 1. Patient position is same as the grade 2. Therapist position at the side of the table. If patient is not able to lift the head, assist the patient. The muscle is palpated over the midline of the thorax.